Hey guys, so I just tried to eat and had a reaction. It wasn't a terrible one, but having blood pressure issues, terrible migraine, stomach problems, just not good feeling. I wanted to do a video like this because I would much rather everybody just see me when I feel great, and this is the reality of how things are normally. And so my hope is that other people who deal with this will find this channel and find it useful and find somebody who understands what they go through. Mast cell and autonomic issues are horrible. I wouldn't wish them on anybody. And so I'm not gonna cry. Just got a little choked up for a second. It's important though to share awareness after my hospital visit last night, and we don't really have emergency rooms for rare disease emergencies. Like, our emergencies are, for instance, like we go in with stomach problems like I had in excuse me, sorry. We have stomach problems, and we have people in the emergency rooms who are having heart attacks or have been shot or stabbed or needing emergency surgery. But I'm having severe pain, and I waited almost 24 hours to go in because I tried everything at home. Every medication, every remedy, heating pad, peppermint tea. I can't even think of them all right now because I'm not feeling well, but I'll try to list them in the description. But I tried everything. Had my husband get Mylanta because I was thinking like maybe it's something that Mylanta could help with. Nothing helped. And so going to an emergency room and not having the adequate care, she's looking for Tylenol for me. Not having adequate care is something that I really want to advocate for, is because we need more doctors in there who understand the crisis that somebody who's going through what we go through, how to handle it, how to treat it, and how to address it in good bedside manner. My nurse was a peach. She was just horrible. And I get it. She had other patients there that their life was at risk. Mine wasn't at risk, but my quality of life is not good right now. And so to me, waiting 24 hours in constant pain before I went in was pretty, good. So I know that there are other people who are going to watch this and totally understand exactly what I'm saying, because before I can make it without going to an ER, and when I went, they did give me the GI cocktail with the lidocaine in it, which really helped because it numbed my stomach, and I needed that for that time that it did that, because I wasn't able to fully rest, but at least I was able to not be in excruciating pain. But there are just so many times when I go to the emergency room, even when I'm having an allergic reaction, since I've already pre-medicated, I'm just sitting in a room uncomfortable and feeling like I'm taking up a bed for a patient who needs it more. We shouldn't have to feel this way. So hopefully more of us will start being better advocates for ourselves and sticking up for ourselves, because it does matter, and we shouldn't have to treat ourselves. We need doctors who can work with us and work through our situations with us and our health crisis with us. So I'm trying to keep this video short, but I'm gonna start crying, so I'm gonna end the video. But I know that there are other patients who don't want to see their family have to wait in an emergency room with them for 6+ hours, who don't want to have their child be exhausted for sleeping on a wall in the emergency room on the doctor's stool, who have a husband who works and then, you know, goes out of his way to do everything to make things okay for our family. So
that was a very comfortable wall.
It's a very comfortable wall. She slept good. I felt so bad. And the nurse was like, it's a liability to have her in the bed with you, because I had her come lay with me. And I've never had a nurse tell me that that she couldn't lay with me before. And that was just, the nurse was just, she was on a roll. So, you know, I had a stomach ache. But our families deserve better, and we deserve better. So this is Rochelle from Rare Rochelle chiming out, and hopefully coming back to you with no tears in my eyes and better stuff to talk about next time. But this is where I'm at today, and I know that the majority of the viewers have been here too. So hang on tight, and, you know, stay strong and try to be the best advocate you can be for yourself, and don't give up.